Hello everyone, this is Catherine RWS and 3B again, and today we are 4 out of 4 of the podcast episode series. And for this one, we will be talking about renal disorders, especially the acute glomerulonephritis and renal failure. So to better visualize and understand this topic, we can think of analogies such as the kidneys being our home filtration plants. For acute glomerulonephritis, patients with this one have their filter being inflamed. We manage this one with the mnemonic of SNAP approach. We have S for supportive care. This means fluid restriction of the patient. N is for normalizing blood pressure with antihypertensives. And A is for antibiotics if the patient has infection. The last one is P for P control. So here we can think of medications such as diuretics or even treatments such as dialysis. So for renal failure, these include the acute kidney injury and chronic kidney disease. The core nursing management for this one is summarized with the mnemonic IOU for the kidney. So I stands for intake and output. This means strict monitoring of the patient's intake and output of the fluids as well as their daily weights. O is for on dialysis. This is necessary when severe complications arise with the patient. This is also indicated by another mnemonic. We have the criteria of the vowels of the alphabet A, E, I, U, U. So you have A for acidosis, usually severe. E for electrolyte imbalances such as hyperkalemia, I for intoxications, O for overload of fluid, and U for uremia. Going back to the IOU acronym, we have the last letter of U, which is for underlying cause treatment. So in here, we can control the patient's diabetic mellitus and the patient's hypertension. So in here, we can implement dietary restrictions, including their protein, potassium, and sodium. So after reading the management of renal disorders, getting through the fluid and electrolyte management, the medications and dialysis and renal transplantation, I feel like it's a much more so of a culmination of the other managements for the episodes 1 to 3 throughout this podcast series. For nursing students like me, it is very important to know the similarities and differences within the renal disorders, such as distinguishing acute kidney injury and separating it from chronic kidney diseases. We've gone through 3 nursing scenarios already in this podcast series, and today I will be sharing with you our last one for renal disorders. So here, a 9-year-old child presents with the following symptoms. He has facial swelling, dark colored urine, hematuria, and elevated blood pressure. So these signs and symptoms can point to a renal disorder such as acute glomerulonephritis. So nursing management for this one includes restricting the patient's intake. Since the child's kidneys are inflamed, it can cause fluid retention and high blood pressure. So nurses should implement strict fluid and volume restrictions, such as what we would usually do for fluid disorders, as well as administering the ordered medications by the doctor. These include antihypertensives such as ACE inhibitors and maybe diuretics for the patient's fluid management. And again, we should also provide the patient with emotional support and give the family members education on how to take care of the patient. So this marks the end of our podcast series. We have gone through a lot of management, a lot of mnemonics, really a lot of nursing scenarios. And really, I hope that we can use these mnemonics whenever we take care of a patient that presents itself with signs and symptoms of maybe the varying disorders that we have discussed. So once again, this is Catherine Arda, BS3B, and I will be saying bye-bye for the last time, and hopefully we have another podcast series in the future. Goodbye everyone, stay safe.